here, and great action by Stephen. Can we now move to Bobby Fishkin? Bobby, are you with us?
Yes, I'm with you. Can
Stop
you hear me?
sharing your screen, Stephen, so that Bobby can share his screen.
Can you hear me, Steve?
I can indeed.
Excellent. I'm just sharing the links to what I'm going to be presenting, and also to this process here. So I think that I just shared that in the chat. So I will share screen as well and see if this works. Please let me know. Are you able to see my screen?
We are indeed.
Okay. So just to share that there's a history in the world of social innovation solving collective problems. Here, this didn't work quite, but I can share it this way. But basically, and everyone has these same slides, so I'm not going to focus too much on the presentation itself, but to say prevention derivatives is why we're here. What we've done in CrowdDoing.world is looked at the history of risk transfer markets. And the world's insurance-linked securities today, if you have wildfire risk, if you have flooding risk, if you have health risk, people think of those staying with their insurer the same way a bank used to keep the mortgage. But just like the banks securitized the mortgages, so too the insurance industry has transferred the risk at scale. Now, if you're talking about a risk that is not preventable, or that would take 50 years to even work towards prevent, such as earthquake risk in the case of Japan preventing it and California not preventing it, risk transfer markets make sense because they create some economic resilience. But if you're talking about risks that are preventable, CrowdDoing.world has argued, and in coalition with a group of partners, that it's a moral hazard to transfer risk that is preventable. And half of the world's risk markets are exactly that: the transfer of risk that should not be permissible to transfer as long as there's an opportunity to prevent that risk. And so we think that there's an opportunity to take, just as risk, when an insurance company has proportional reinsurance, they might take half the risk and half the liabilities and half the proceeds. We think likewise you could have, instead of a risk transfer derivative, a so-called prevention derivative. And if we did that, what we would do is say every stakeholder at risk can collaborate to prevent that risk. And that we
Bobby, just to frame this, one of the big changes that you pointed out is changes in what insurance companies can focus on in terms of their own attention to covering costs that result from a disaster to preventing the disaster, right?
Well, right, because right now they're transferring risk, which means they're going to pay for the tragedy, but the stakeholders don't want them to pay for the tragedies that are preventable. They only want the insurance companies to pay for the tragedies that are not preventable. But as our collective ability to prevent has gotten radically better, we have not changed our economic architecture of this. So I'm just going to show this shift from risk transfer markets to risk prevention markets is something where we can imagine, just like 5 years ago, I worked on the social impact bond feasibility study for Marin County, and we got the General Hospital to offer to be a private sector contingent payer. If you think about not a social impact bond model, but a massively multi-stakeholder contingent payer model, then getting each entity that is at risk to pay their fair share of the opportunity to prevent it, instead of having them transfer the risk. Because if the risk gets transferred to too many entities, it's in no one's interest or feasibility to prevent the risk. What we did is we looked at the PG&E wildfires and the bankruptcy, and saw that there's 80 Fortune 500 companies that lost tremendous amounts of money. And we know that there's going to be, from talks with the insurance industry, that fire and that catastrophic cost is going to recur at a rate of 2.5% to 10% every year for the next decades, depending on how aggressive your climate change modeling is. And so we're identifying that should every stakeholder, whether insurance or government or corporate or small business or individual, identify what they are expecting to lose, and then agree to pay 0.5% to 5% of that expected loss, should that expected loss be prevented, should that outcome be achieved, and then depending on how much of the risk is prevented, then we think that each gap in social innovation could be addressed at the systems change level. So our thesis, and I'll just stop sharing and just speak to this, our thesis in this regard is that there is abundant evidence that the risks today that we're dealing with in transferring are like the earlier risks hundreds of years ago when they prevented people from gambling on whether someone dies or not if they don't have a life insurance kind of structure, because they didn't want a moral hazard of people having an incentive for people to come to harm. And right now we have large industries that only are profiting from the transfer of risk, but we think that there's a shift that could be possible both as a matter of practice, underutilized law, because right now every reinsurer in the world, when the risk gets transferred, they're banned from doing anything to prevent it. So are the retrocessionaires. So is every other stakeholder in that insurance ecosystem. What we need is collaboration at the scale of our prevention gap per stakeholder in order for us to get social innovation to the scale and scope of our collective problems. And so in prevention derivatives, we've organized volunteers from around the world to help us research what is needed for that to happen. We've had 160,000 hours of CrowdDoing.world volunteer time on systems change, and this is one of our initiatives. With that, I would like to wish that we can prevent all the world's risks that social innovation can prevent and bring social innovation to the scale and scope of our collective challenges. We see prevention derivatives as a extremely under-leveraged point of intersectionality for how to bring social innovation to scale, because effectively the world is right now built in social innovation terms as a push sector where impact investors and social entrepreneurs push out their products to the world. And what we are saying with prevention derivatives is we need every stakeholder who would benefit from social innovation reaching the world to pull those social innovations into context in the world by agreeing to take on responsibility for their fair share of the risk of harm to them being preventable through collaboration. So we think that there's ways to prevent tragedies of the commons in stakeholder internalization of externalities, not only due to the question of saying at a regulatory level that there should be a priority if a stakeholder is able to prevent risk, it shouldn't be allowed to transfer the risk. Likewise, we think that there's a level of feasibility for prevention derivatives, not only that each stakeholder should be able to understand its risk, but that as more stakeholders agree to internalize their fair share of the risk, we think that that then means that that should change everyone's willingness to commit. So our model is that if each stakeholder, the more stakeholders commit, the more all of the other stakeholders co-match. So each stakeholder ends up getting matched by enough other stakeholders so that their net present value of the contribution at the moment they make it is net positive. And we think that we can do that at the level to show that every stakeholder has a positive return on contingent, proportional, collaborative prevention through addressing social innovation gaps at the level of the financing of the prevention of risk to stakeholders. So, Steve, I don't know if there's questions, but I wanted to share that.
Thanks so much, Bobby. So one of the examples that Bobby is working on is growing out of the forest fires in California, but obviously it's relevant to Australia and other places. So there was enormous payments like the PG&E, the power company, the insurers of the homes that were burned down, the public forests that were lost. So all of these stakeholders had some costs accrued to them, very significant, after the fire. So is there some way that we can shift that from paying for the losses that are arising from the fires to actually putting in prevention tactics, such as, so Bobby, would you just like to give an illustration of the prevention tactics that you're talking
Sure.
about?
Yes, so just bottom-up descriptions of this. So in Southern California, one of the presidential libraries almost burned down, and it didn't because there were 500 goats who had eaten the conflagration material 6 months before. And that's a social innovation that's thousands of years old for preventing fires. We look at wildfire risk and we see that 90% of the risk and the cost is not insured against. And so what we're trying to do is bridge the insured stakeholders and the non-insured stakeholders who all have an interest in prevention, but have not collaborated across those divides. And we think that's possible. In the case of California wildfires, millions of people had air pollution risk to their health from the fires, and they've never been offered a subscription for prevention. But if we can offer every stakeholder a subscription for prevention proportionate to the social innovation gap they and the communities they're a part of face, we think that that can bring social innovation to the scale it's needed in the world, or it could be a key leverage point to do so.
Thank you so much, Bobby. So we've had these 4 examples before you of these different innovations. One,
if you'd like to share anything, Bobby Fishkin.
Sure. Sorry. I was just going to say that I think that the impact management project didn't have unanimity on or consensus on the point of impact additionality. And in that spirit, I think that it's worth connecting to where we can remove that gap and where we can connect to if we can connect a future outcome to who are the beneficiaries of that. In other words, if we can get all those stakeholders to acknowledge that in the present, then I think we can form outcomes that cut across private sector, public sector, shared value creation. And I think the problem is we've been creating an outcome as an isolated indicator of a company, and we treat an externality or as CSR, gratitude, or PR, the outcomes that they're getting. But if we got to full sustainable development goal integration gap or social innovation gap framework, we'd say, okay, how do we prevent 80% of the catastrophe? Who collaborates on what, in what way could do that could allow that to happen, and then work backwards from there for every stakeholder with liabilities today. In other words, I think that right now the social innovation sector doesn't get financed from trillions of dollars of liabilities that exist for every individual and every institution in the world. I think that we get financed off of the goodwill of people trying to do something constructive, but not necessarily connecting to the hard additionality of saying, look, if 70% of life insurance gets securitized in America, why can't preventing death by 5, 10, 15, 20 years directly get part of the feedback loop? Right? Like, why is it that life insurance is only risk transfer, and yet we talk about the social determinants of health as though we can't have an outcome case to be made? In other words, the social innovation sector is absent from the dialogues of where the outcomes are having trillions of dollars of financial consequences right now, because we're not connecting hard additionality to where stakeholders need it to allow us to scale cooperation around these threads. So
yeah, I mean, I think it's interesting when we think of this progression, like the evaluation world's been around for decades, even a century or more. And they already know all of this, but they know it so well that they, for a while, if I may completely overgeneralize, had sort of lost the ability to convey it to the masses in a way the masses could relate to. So then this movement came about, Social Venture Network and all that it has been involved with, and all the people who are around that whole movement, as wide as it is, not just Social Venture Network, started to say, okay, we need to understand something about impact. So people started to think about outputs. Okay, did we create any jobs? Did we produce carbon emissions or less than we were before? Those are the easy to count things. And they're basically the outputs that are suggestive that something meaningful is happening, but they are not the whole story.
And I think the part of that we could scale is just that we can have the positive risk gap bring our movement to scale. If all the institutions of the world embraced social innovation as the positive risks that they're neglecting, then we'd be able to instantiate, because it's already been 10 years since every risk management department in the world added positive risk as equally important to negative risk into their structure, into their law. And it's been, Project Management Institute, ISO, all the standards have already integrated positive risk abstractly, but not culturally. But if we just culturally say, okay, institutions of the world, the social innovation sector is your positive risk gap. We have a bridge. And if that can happen through the outcomes that you're defining and we're defining and all of us in this room are defining, then suddenly we have a flywheel that competes with the macroeconomy, competes with the
that's
broader
the hope,
society.
right? That's the hope. Excellent point. And this is the notion, I think, having translators who can make the progressive idea that's visionary, that's about positive, risk, innovation risk, that can translate that into a means that allows a large part of the mainstream to get it and put their arms around it. And that takes Ted, who is very good at explaining things in a way that people who don't have their heads deep in this every day can understand. And it takes the sort of impact measurement professionals of the world, impact management professionals who are sort of trying to be this bridge. And it takes visionaries like you, Bobby, and like many of you on the call. So I am wanting to make sure that we get to any other questions. I just wanted to also note that the World Benchmarking Alliance is working on assessing levels of sort of current levels of outcomes for populations around the world on key issues. The SDG, the Sustainable Development Goals, and the UN Development Program are also working on setting baseline data, making that available publicly for every SDG in every country, so that investors who want to act on those SDGs in a given place have that baseline information more readily available as a public good. And that's a key part of making this whole exercise more affordable. So yeah, and I want to just give a shout out to your work, Bobby, with CrowdDoing.world. So folks, check that out. Really interesting stuff. If you can keep up, you might need to record it and replay it to listen to what he says.